a little bit more on the right side.
Okay, good. Let's check this side over here. This is the C side. So that's much more effective than just doing it statically. All right, so now we're going to do side posture adjustment, and I don't recommend you do this at home. There we go. All right, now we're going to do his neck. C6. Good. Yeah. And then C2, we found earlier. So it will help relieve headaches.
Wow.
Very effective for headaches. Good job.
Wow, that was great.
Yeah. So today I'm here with Adam from Baysox. We're going to do an examination, check him out, and actually do an adjustment today. He's been treated before. It's been a few years, so we want to do a reevaluation, make sure everything's okay. What we do, first of all, the examination is a neurological exam, check his nerves, make sure the nerves are okay. We check 3 branches of the nerve roots,
Okay.
sensory, motor, and visceral. So the visceral branches are your reflexes, the sensory is your sensation, and motor is the muscles.
Okay.
Okay. So we're going to test those branches, and if there's ever any problem that we find, we can order x-rays, MRIs. We work with orthopedists. If we need an orthopedist, we can refer to an orthopedist, neurologist, pain management. So we have all that at our disposal. So we always want to make sure we do a proper examination before we treat you.
Fantastic.
So we're going to start off with just doing reflexes right
Okay.
now. So we'll check your upper. Just real quick, you see him jump a little bit. I'll be as fast as I can because otherwise I might lose you guys. Might fall asleep. All right, good there. Okay. So normally we do this gown, but we'll save Adam the embarrassment of gowning him. So you can see that he has good reflexes. And we'll check sensories. We're going to check the upper for now.
Like this.
All right. So you compare this feeling with this feeling.
Okay.
Looks like it hurts, but it's just nice.
Yeah, it doesn't at all.
And about the same on both sides?
Yeah, yeah. Maybe I felt a little bit more on the right side.
Okay. Let's check this side over here. This is the C side. Interesting. About the same?
Yeah, about the same.
Let's try this again over here. Make sure your sensor. Does it feel like the pins? You can feel the
Yeah,
pins?
I can feel the pins.
Okay. Good. Let me check just a little further down, C6. A lot of people have tingling and numbness if they have a problem in their neck, middle of their neck.
Okay.
Any trouble with that?
No.
Okay.
I'm just supposed to feel it regular?
Yeah, there should
Okay,
be the
yeah.
pins on both sides.
Undoubtedly, yeah.
So let's check the motor, upper extremity. Let's do deltoids. So hold, just hold up like this. And don't let me push. Good. And hold like this. Don't let me pull. Good. Biceps. We'll do triceps. So have your arm like this. Push straight down. That's it. Same thing here. Good. All right. So upper, good shape. Lower extremities. I'm going to have you. I did not do the sensory part just for the purpose of the video, but I'm going to have you stand up, and I want you to just lean back at the waist. How's that feel?
Good.
Okay, and try and touch your toes. Any discomfort with that?
No.
All right.
I'm not very flexible.
I see that.
I was
That's
last
part of
in
why
the
you're
sit and
here.
reach.
Yeah.
Yeah, exactly.
All right, so typically what we do, we go through the range of motion. I'm doing this again for instructional purposes.
Mhm.
Range of motion for the lower back, the lateral flexion, rotation, make sure everything's okay there.
Okay.
I'm just kind of speeding it up for you.
Sure.
So the cervical, want to check the neck, look up, look down, make sure there's no discomfort. Go lateral flexion, that's it, the other way. Good. No discomfort. Okay.
No.
And some orthopedic tests we'll do if we see anything, compression, make sure there's no nerve root compression down the arms. It gives you the sensation, same with the legs.
Okay.
We check, we do heel walk. You should be able to walk on your heels, and if you have one foot that won't go up, that's called a foot drop or
Oh, yeah.
loss of L5. Toe walk, that's S1. Okay, you should be able to get your heels off the ground. It should feel nice and strong.
Mm-hmm.
Good. All right, so we did kind of a speed examination there. Another aspect of our examination is palpation. Palpation is when a chiropractor actually checks the vertebra to make sure everything's moving okay. We check we work on and treat every joint in the body, even the skull. We have joints in our skull as well. So that the art to chiropractic is the manipulation. So manipulation is our calling card. It's the only form of treatment that in medicine that we do. No one else in the field does what we do, and manipulation is very valuable. I've been in practice 28 years and I still love it because the results we get are amazing. People come in with years of pain and problems and dysfunction, and we treat them, and most of them result in positive outcome. A lot of people we treat, they have neurological deficits, so tingling numbness in their hands or feet, herniated discs, that kind of thing. So we treat a lot of those conditions, and very successfully. So I'm very happy about that. So what I'm going to do right now is a palpation of Adam's neck. I'm going to check his vertebrae. He has 7 cervical vertebrae, and I'll check each individual one, and I'll be able to tell Adam where it's tender because I can feel where it's not moving. Basically, it's stuck. So I'm just going to come down and just motion each side. So I'll go to the right here, right lateral flexion, left rotation, so I can feel right here, not moving very well, and a little bit right there. That's C2. So C5, 6 on the right with Adam, C2 on the left, and we get up here. This is T1, so I flex this way, check the motion, so he's not moving very well this way, so I'll be adjusting T1 as well. Then what we'll do is have Adam lay on his stomach, lay face down, and I'm going to check the rest of his spine. So if we check his leg length, this is something that most chiropractors do. He's a little bit right short leg. His pelvis is pretty well lined up. He's a little bit posterior on the right, which rotated back on the right. So we've got the sacrum here, ilium. This is the left sacroiliac joint. Check for motion here. And on this side, so there's a little restriction there. And one of the big ones is L4-5, L5-S1. That tends to be a problem with a lot of people. Put a lot of weight on that area. So when I flex him to the right, I'm not getting any motion. So when he bends to the right side, these vertebrae are not flexing. Along with the sacrum is also locked in position, especially on the right side. So that'll also affect the muscle fibers that come through here. Muscle fibers attached to the ilium here, run up the spine, paraspinal, quadratus lumborum, but it'll affect up here, L1, and I can feel already that's locked. So that's not moving, and that's related to the L4-5 and the right SI joint. So muscles tend to follow joint and nerve. So if there's a joint dysfunction or a nerve dysfunction, you're going to have muscle spasm. Muscles don't tend to go into spasm on their own. So they're under the influence of the joint and nerve. Right? So what we do is we manipulate these areas to get free motion back into it, and that will help the muscles to calm down. If you go for a massage or just do muscle work only, you're not really getting to the source. You're not getting to the cause of the spasm. And that's really important. That's the part that I enjoy over the 28 years of my practice, to get full function back into the spine, back into the joint, so the muscle can settle down. All right, so we've already determined that. We go further up. Of course, sitting at the desk, computer, it's all tied up in here, which affects these muscles out through here. Many of us feel tenderness back here. And Adam's actually pretty good, not a lot of spasm. He's got some here, some trigger points. Trigger points is actually lactic acid buildup in the muscle. And eventually, if you let it stay long enough, the lactic acid will become fibrotic, which is scar tissue formation in the muscle. So we've done it, preliminary evaluation, examination, everything. I just showed you a short version a moment ago. So we're actually going to give him an adjustment. As part of our adjustment, we're just going to do what's called flexion distraction for his lower back to try and loosen up the joints and actually open up what's called the facet joints in the back of the spine. So we have a nice automated machine here. It's mechanical flexion. Now what I do is I'll hold the segment. It needs to be opened up, so L4-5. Work our way up. This is really good for people that have trouble with leaning back. When you lean back and you have pain in your lower back, especially sharp pain, that's facet usually. Most people, especially over the age of 30, have facet arthrosis or arthritis in the facets. And that can give you a source of pain, not just your lower back, but even down the legs. It's a different kind of referral pain. Doing okay, Adam?
Doing good,
Good.
but I do feel it.
Yeah, you feel it open up, right?
Oh yeah.
Yeah. So then since I have this machine, I love it. I can do some muscle work. So whereas quad muscle, it's quadratus lumborum or rector spinae muscle, it's in spasm, I'll hold it and actually go through the motion and let the trigger point pass under my thumb. It hurts, right? But it feels good. It hurts so good.
Exactly.
So we do that. Let go. Then I put a little elbow on the other side. He's got a nice trigger point right here. How's that feel?
Good.
So it looks like it hurts, but it's really... So I'm cheating a little bit with the motion, but it's much more effective than just doing it statically. Okay. So we'll turn that off. And then we'll start adjusting. So I'm going to go after L1. Adam, take a deep breath. Now, nice and gentle. Okay. Oh yeah. Now this L1, not much movement there, so I'm going to actually adjust it on your side.
Okay.
Now, this is the T1 level. T1, so it's going to be C6, 7, T1, mainly 7 and 1, right here. This is a big one. This is where thoracic outlet is. Very common in athletes and people that work at a desk all day long, which is probably 90% of us. Oh yeah, that's a big one. And this is the type of move that there aren't many chiropractors that do this move. It's difficult. There's only a couple in the state of Maryland I know that actually do this. It's called a thumb move, but it's a modified thumb move. That's all this one. Drop your shoulders. Good. Excellent. Wow. Looks violent, but it's actually very, very relieving. What do you think about that one, Adam?
Yeah, I a lot more than I thought it would.
Yeah. So that's a very powerful adjustment. Now this is just trigger point work here.
Oh.
So we always do muscle work because we got to get the muscles to reactivate again. So we did everything we can do here. We're going to have Adam now lay on his side.
Okay.
We're gonna work
Right
on
side?
Yeah, we're going to do right side. We're going to do L1 and the sacrum. And I'll put Adam in position. You just relax everything. And as a patient, all you have to do is just lay there. You don't have to do a thing. I'll take care of it all. All right. So let this fall. All right, so now we're going to do side posture adjustment. And I don't recommend you do this at home. There we go. And take our L1 here. Okay. Then we'll switch sides. Yeah, L1's a mess. Back up here. Just like that. So basically, what Adam has done here is it's an accumulation. This is everyone in the population.
Yeah.
This is an accumulation over the years of joint restriction. And you can walk around for years with this and not have any pain.
Right.
And you haven't really had much pain.
No, not a
We're just
little
doing a
bit.
tune-up, basically. But it prevents problems down the road. It's very, very preventative. There we go. That one. Good. And lay on your back. So we got L1, yay. That was a stubborn one. So this is something that, again, you can walk around with joint restriction for years, not have any symptoms. Some studies have shown that it can actually slow down the process of degenerative arthritis.
Wow.
And I have patients that have been coming in, well, my oldest patient's 99.
What, 99?
She has very little arthritis in her neck. She's been seeing a chiropractor since she was a child.
Wow.
And chiropractic's been around for 150 years
Yeah.
in the United States. Thousands of years. All right, now we're going to do his neck. C6. Good. Yeah. And then C2, we found earlier. So it will help relieve headaches.
Wow.
Very effective for headaches. More muscle work, yeah. So these muscles have been bound up for years,
Yeah.
and we adapt. We're an adaptable species, so something happens, our body readapts. That's normal. So it's got a nice fibrotic tissue here because it's been there for so long.
A lot of time at a desk.
Yep. Yeah, that'll do it. Or if you sleep on your stomach, that's not good either.
Exactly.
There's a lot of things. So your chiropractor will go over what you should be doing on a daily basis, your occupational therapy, how you should sit, sleep, eat,
Okay.
nutrition. We cover all the bases. So very good.
Thank you so
Yeah, you
much.
did a good job.
Wow, that was great.
Yeah.
That felt awesome.